Good evening and welcome, dear guests. I am delighted to meet you here today to discuss an important topic for our health, ACTIVIDAN and its benefits for the vascular system and prevention of cardiovascular diseases. Through this event, together with our experts, we will explore in more detail how ACTIVIDAN can help maintain our cardiovascular health and how we can take proper doses to ensure we live a long and healthy life. So let's begin. The circulatory system is a vast subject that not only refers to the blood circulating through vessels, but also lymph and formed elements of blood. There are different types of blood vessels, such as the large and small circle of blood circulation and the coronary circle of blood circulation, which provide transport of blood and lymph in our body. At the center of attention are the properties of blood, its functions, and composition, which must provide our cells with oxygen and nutrients, eliminate waste products, and prevent the formation of blood clots. In this context, our product, ACTIVIDAN, plays a crucial role in maintaining our circulatory system in proper condition. It is important to mention that the formation of blood vessels and the formed elements of blood begins as early as conception and is crucial for their proper development and functioning of our circulatory system. In the early period, including after birth, red bone marrow is mostly found in the tubular and spongy bones, responsible for the production of blood, and in children, this role is fulfilled by the liver, one of the main hematopoietic organs. Due to this fact, changes that occur in the process of hepatic reconstruction can play an important role in the development of various liver diseases, and in some cases, liver transplantation may be necessary. As we learn today, even excessive administration of paracetamol, even in a small child, can lead to complete liver failure, often requiring liver transplantation and being a very costly operation. Therefore, from the moment of conception, the proper formation of the circulatory system, including blood vessels and organs that maintain the hematopoietic system, is very important. Hence, ACTIVIDAN, as a food product with beneficial effects on the entire human body, should be used as a preventive measure against diseases in aging, from conception and throughout life. It is essential for maintaining a self-regulating neuroendocrine system and all processes carried out by the human body. There is always potential involved in our ability to cope with destructive factors. Concerning our circulatory system, we must understand that the heart is our pumping station, and cardiovascular diseases are among the leading causes of mortality worldwide. Disrupted heart function can affect the entire circulatory system by transferring oxygenated blood into the venous channels and back into the heart, allowing blood circulation in the body and maintaining a constant internal environment. The state of the vascular and circulatory systems determines the duration and quality of life. Our blood is composed of formed elements in plasma, and its composition is largely important for the functioning of the immune system and maintaining the hematocrit, which is the ratio of formed elements to plasma in the blood. In the plasma, many dissolved substances can be found, and most of the substances that need to be transported in the blood are not dissolved or are complexes that join the formed elements of the blood. The formed elements of the blood carry out various functions, not only providing oxygen or binding toxic substances and destroying viruses and bacteria, but also transporting proteins used for cell reconstruction, among others. It is important to maintain an adequate number of red blood cells, leukocytes, and a normal hematocrit in the blood, as these formed elements have normal lower and upper limits that must be monitored. Differentiation of the formed elements of the blood occurs in various organs, such as red bone marrow and the thymus, where the final selection of cells occurs through apoptosis. It is important to maintain a residual status within normal limits to avoid various conditions. This problem of failed apoptosis is closely related to many autoimmune diseases, which can ultimately lead to the breakdown of the walls of blood vessels and the damage of organs such as the liver, kidneys, and spleen, as well as joints, which are involved in the development of specific diseases. Apoptosis plays a crucial role in the production of formed elements of the blood and occurs in various organs such as red bone marrow and the thymus. Particularly in our youth after birth and until almost no more expected lifespan, the occurrence of apoptosis is evident on average, especially towards puberty. For this reason, it is important to maintain an adequate number of red blood cells, leukocytes, and a normal hematocrit in the blood, as these formed elements have normal lower and upper limits that must be monitored. This problem of failed apoptosis is closely related to many autoimmune diseases, which can ultimately lead to the breakdown of the walls of blood vessels and the damage of organs such as the liver, kidneys, and spleen, as well as joints, which are involved in the development of specific diseases. Apoptosis plays a crucial role in the production of formed elements of the blood and occurs in various organs such as red bone marrow and the thymus. Particularly in our youth after birth and until almost no more expected lifespan, the occurrence of apoptosis is evident on average, especially towards puberty. For this reason, it is important to maintain an adequate number of red blood cells, leukocytes, and a normal hematocrit in the blood, as these formed elements have normal lower and upper limits that must be monitored. ACTIVIDAN can be used before and after surgical procedures, reducing physical stress on the body and preventing the formation of blood clots in blood vessels. Additionally, it can help improve vascular wall health and prevent narrowing, although we must pay special attention to the quality and structure of our blood vessel walls to prevent atherosclerotic deposits and improve tissue oxygenation. Vascular problems are often linked to many diseases, and we must be mindful of maintaining an adequate number of vessels to prevent damage to small blood vessels and allow for their immediate repair after damage.
ACTIVIDAN can be used before and after surgical procedures to reduce physical stress on the body and prevent the formation of blood clots in blood vessels. Additionally, it can improve the quality of the vascular wall and prevent its narrowing. It is important to pay attention to the quality of the vascular wall structure to prevent atherosclerotic deposits and improve tissue oxygenation. Vascular problems are often linked to many diseases, and maintaining an adequate number of vessels is essential in preventing damage to small blood vessels and allowing for their immediate repair after damage.
If I remember correctly, I started studying the types of fucoidan in China in 2014 and conducted many studies, including clinical trials in cardiology centers. I have accumulated a vast knowledge base regarding infarction, cardiac atherosclerosis, and acute myocardial infarction patients, tracking how much the myocardium is affected. Experimental studies have shown that our ACTIVIDAN slows the process of myocardial cell death in cases of damage and clot formation. Even when thrombosis occurs in blood vessels, the cardiomyocyte struggles to maintain its life, having a certain reserve that allows it to gradually change its structure. When this reserve is exhausted, the myocardial cells are destroyed, and microcavity can form. Our ACTIVIDAN increases the stability of cardiomyocytes in cases where they are damaged due to interrupted blood supply, providing time for their recovery. Additionally, it prevents the development of pathological changes in connective tissue and offers healthy cardiomyocyte cells more space to grow in case the affected cells die. In practice, the size of healthy cells around them increases, forming new cellular connections. By the proper use of ACTIVIDAN, sudden changes in the reddish tissue can be avoided. I have observed these benefits personally through the daily use of ACTIVIDAN. Myocardial hypertrophy was not previously diagnosed, but ultrasounds and other research methods showed that there were no tissue ruptures, but rather hypertrophy. As a result of the increase in cell size and the formation of new cellular connections, certain areas were covered where myofibrillar cords had died. The thrombus that quickly dissolved did not allow cell death. The mass of cardiomyocytes that was damaged following the infarction would have been replaced with connective tissue, forming a fibrous tissue scar. On the posterior wall of my heart, at the age of 40, the scarring changes were confirmed and praised by some doctors when they saw their grandchildren. Our abilities with ACTIVIDAN and apoptosis prevent the formation of these fibroid changes in damaged tissues, thereby inhibiting the progression of the disease. Our ACTIVIDAN precisely targets each tissue, having the ability to enhance the working capacity of new cells and prevent the development of diseases. Presently, our research efforts are largely focused on ACTIVIDAN. Fucoidan is referred to as the medicine of the future and has the potential to prevent aging and disease development, as well as strengthen the body's regenerative capabilities. Our immune modulatory factors of ACTIVIDAN, as well as the limitation of inflammatory processes, currently have no rivals. However, many doctors are against this product because they consider it a dietary supplement and not a medicine. Despite these aspects, I have consumed fucoidan for many years and use it regularly. I have encountered doctors who oppose this supplement, but have remained firm and have continued to take it, even if I was warned that I would assume responsibility for my life if I did not take the prescribed medications. We have increased the dose of ACTIVIDAN due to symptoms, including shortness of breath and elevated heart rate, which are not good. Currently, we are confident that we will be able to treat this pathology by increasing the dose of ACTIVIDAN. Our ACTIVIDAN stimulates the growth of new roots of blood vessels and the development of new blood vessels in both damaged and normal tissues, forming a new amount of small blood vessels that maintain the internal balance of our body. These cancer cells are destroyed through the process of apoptosis since our ACTIVIDAN does not hinder the development of blood vessels in modified cells such as malignant ones. Only cells with normal morphology are nourished with nutrients and oxygen. This makes ACTIVIDAN useful in the treatment of oncology processes. Obliterative endarteritis is a condition frequently found in men and characterized by damage to blood vessels. These vessels narrow by up to 60%, leading to decreased supply of oxygen and nutrients to tissues and accumulation of metabolic products. These changes can affect any part of our body and lead to necrotic modifications. Stopping the disease is very difficult until blood vessel circulation is restored and blood supply to the affected area is restored. If these conditions are not met, necrosis will continue to spread and ultimately lead to death. Blood infection is an especially serious condition as toxic products affect all organs, including the brain and heart. In the case of an elderly woman who was given permission to die at home, after 6 months of using ACTIVIDAN and applying compresses, blood circulation improved and the regeneration process began. By maintaining normal blood circulation and a normal blood composition, including hormones and other substances transported through plasma and blood-forming elements, even dead tissue zones can be partially restored. It is important to maintain the vascular channel in an adequate state and to prevent any vascular modifications. People do not have enough patience for treatments that require 6 months, but the effects of ACTIVIDAN are evident when used correctly and not abandoned. ACTIVIDAN can be used for thrombosis in any part of the body, any organ, or limb. Sometimes doctors refuse to treat amputation cases, but ACTIVIDAN can be used with good results. In cases of acute illness, it is important to use appropriate doses of ACTIVIDAN, especially in cases of thrombosis and heart pain. Using ACTIVIDAN, organs and tissues can be quickly restored, and people can live a full life. Here, you can take doses of 6, 8, 10, and even 12 milligrams of ACTIVIDAN, as it is important to begin dissolving the clot and prevent its formation immediately after a problem occurs, until emergency help arrives. This will prevent the development of connective tissue and protect the myofibrils in the heart. It is important to talk to your doctor and let them know that you are taking ACTIVIDAN. If you are in a situation where blood vessels are already modified, it is recommended to take at least 1.2 milligrams of ACTIVIDAN daily to maintain blood circulation until blood vessels heal or new ones develop. Even young, healthy individuals should take doses of 5 milligrams per kilogram of body weight. It is important to understand that ACTIVIDAN is necessary for maintaining vascular health. It is important to nourish your body with minerals, vitamins, fats, proteins, and carbohydrates to maintain organ and system health. By consuming healthy foods and taking ACTIVIDAN, you can live a long and healthy life and take care of your loved ones.